Hi there, my name is Anna Dolopo. I'm a licensed acupuncturist and I've been in practice since 1999. This is going on my 19th year in practice, and I practice in Laguna Hills right off the Lake Forest exit. This is my 66th video and I'm going to be talking specifically about eating disorders, um, food addictions. And the reason why I'm talking about this today is because I'm treating some patients with drug addictions right now. And it's not the same thing, but it's similar in some respects. Many people now don't know that in the mid 90s, I did work at a homeless shelter where I treated a lot of drug addictions, and we had really, really good success. Now, in treating some of my patients with drug addictions and alcohol addictions, it got me thinking about what I went through when I was having my eating addiction and, serious food disorder when I was younger. And I'm 44, and I started receiving acupuncture when I was 20. And I really committed to my health age from 1994, 95, 96. And in those first 6 months, I remember feeling tremendously better. And during that time frame, I lost 48 pounds. This is before marriage, before kids, and that was excess weight from how I was eating, how my hormones were, and a variety of other things. During that time frame, my depression was healed, my anxiety was healed, my periods became perfect. When I say perfect, I mean they were regular, 20 to 32 days. They were perfect in the sense that they were 3 to 5 day periods, no clots, no symptoms, no PMS, no headaches, no breast tenderness, no lower back pain. There were bright red blood, and there was no clotting, and I talk about that in other videos. No pain, no need for the hot pack and 3 textbooks on my abdomen. So that was healed. My skin issues, my bowel issues, not being able to go have a bowel movement more than once or twice a week. My constipation healed. My digestion really healed. My immune system healed. And so, so many things improved, but most importantly, my mental health improved. My depression, my anxiety, that was fully healed. And now, going on my 19th year in practice, I tell people, that depression, that anxiety can heal. I'm not a therapist, but I can tell you what I went through and what I've seen my patients go through, like heal, significantly improve, or fully heal from decades of mental health issues. So what does that have to do with an eating disorder? Well, for me, and I'm going to talk specifically about my relationship with food at the time, because I can sit here and talk about, there's quite a few testimonials on both of my websites, and several of them are on the weight loss and healing from eating disorders. Not my favorite thing to treat because it takes a lot of work. And I know what to do on my end, but that means people have to show up. And for them to show up, it means they need to be committed to themselves. And for whatever reason, and I know quite a few of those reasons, some people don't want to invest in themselves. But let me tell you what happened when I invested in myself to heal from that eating disorder. When I realized that the eating disorder wasn't how many calories I was eating. It wasn't about necessarily the food that I was eating, but it was how exactly I viewed food and the relationship I had with food and how I felt when I ate food. I mean, I would count my calories when I played the violin to see, how much weight I would lose playing the violin. I mean, that's just ridiculous. I was obsessed with numbers. I was obsessed with, if I do this workout, I'm going to lose this many calories. And if I eat this food, I'm going to gain this many calories. It wasn't like the workout was an enjoyment of doing that workout and how it would make me feel, how exhilarated I would feel when I would take whatever, that exercise class. It was basically, I didn't like how I looked. I didn't like how I felt. I didn't like my relationship with food. I didn't like food. And you have to have food. You have to eat at least 3 times a day. It was it's now amazing to me how I existed for so long with that kind of relationship to food. And so, I apply some of that information with how I treat my patients with drug and alcohol addictions. Um, but this one specifically regarding food addictions, I'm happy to say that I'm not a chocoholic anymore, and I haven't been for about a couple of decades now. When I look at chocolate, it's not like, oh my gosh, I'm thinking about it and counting down the minutes of when I can eat that chocolate. Like I'm looking at a basket right there that my patient gave me for Christmas, and there is a lot of chocolate in there, and I think I've opened up two, and maybe they were like a week apart or so, and one of them I threw away because it wasn't my favorite chocolate. I took a bite of it, and I'm like, this is good, but I didn't really feel the need to eat the rest, so I threw it away, which is unlike how it would have been a couple of decades ago when I was such a chocoholic or I was hypoglycemic. Like if I didn't eat, I wouldn't just kind of physically get ill. I would emotionally, mentally get very upset, and I would it was not good. I would get very angry, I would get very anxious. I would, people were afraid to be around me if I didn't eat. And all I had to say was it wouldn't even say like I'm hungry. I wouldn't even just say I'm hungry. It would just like quickly get to a point where I have to eat right now, and I'm already angry, and it didn't feel good to know that I was that person that people didn't feel comfortable around if I didn't eat. So, um, it's I'm very happy to say that 1994, 95, 96, my health really improved. I lost 5 sizes. I lost 48 pounds, and my periods became perfect, and my skin became pretty perfect. Um, I just digestive issues pretty much went away, having a bowel movement every day and feeling good about myself health wise, feeling good about myself mentally, feeling good about myself emotionally, feeling good about my self worth and my self esteem, and being able to talk to people without having anxiety, sweaty palms or sweaty armpits, or just not feeling frazzled or overwhelmed if I wanted to speak up in a class, being confident to raise my hands and not feel like people were judging me. And this was all relevant to that eating disorder. Not eating out of stress, not eating out of, not stress eating. Just looking at food like it's an essential part of my life. I have to eat, and being able to eat slow without feeling like I gotta gobble it down, not because I was in a rush, um, just because it became my way of life, because I was constantly under duress whenever it came to food. My relationship with food for the last couple of decades is really, really healthy. It is what it is. I do my best to eat very healthy. And if it's not the most healthy thing, I'm not going to feel bad about it. If I do have something sweet, I'm not going to feel bad about it. I don't crave sweets anymore. I don't crave chocolate anymore. I just don't have cravings. If I feel like, oh, I feel like having Italian today, then I'll eat Italian food. Or if I feel like eating Chinese food today, I'm going to eat Chinese food, or, so on. If there's something that I want to eat, I'm just going to eat it. I'm not going to think, how many calories is this? Or, I have, it's just part of life now, as opposed to, this is an enemy. Food used to be an enemy, and it's not about counting calories. It's about eating healthy for my health. It's eating from a Chinese medical perspective, like, okay, I have this going on, maybe a little tummy upset. What can I eat? If food is more like a medicine, and it's just something to share and something fun, as opposed to feeling guilty about it. So for those of you who may have an eating disorder, whether it's bulimia or overeating or anorexia, there's so many ways to approach an eating disorder. For me, Chinese medicine has been essential. At that time, it was essential to heal me. And in so doing, all these other things improved. So if you have any negative relationship with food, really consider getting acupuncture. And if you're here in the Orange County area, I'm right off the 5 freeway off Lake Forest, and perhaps you might want to try it. It's really important to watch my video called Accountability 3. It explains that easy cases is those first 10 treatments, and more difficult cases are those first 20 treatments. No one wants to hear that, but that's the truth. You can't expect something that has been, affecting you for so long to just heal in a few treatments. It's just not going to happen. And that's why I tell people from 1994 to 1996, my health greatly improved. The bulk of that healing really happened in those first 6 months. But, it's just the reason why eating disorders are not my favorite thing to treat is because it really does take commitment. And many people aren't ready to make that commitment. But I can tell you this, if you're one of those people where you are ready to live, feel, breathe, and see that better version of yourself, you are worth the effort. You're worth the commitment. You're worth the investment. Just know what you want. And if what you want is to heal from an eating disorder and have a very positive relationship with food, then you might really want to consider investing in yourself. I would say a minimum of 3 months, at least once a week, but really ideally, depending on the severity of your eating disorder, 2 to 5 times a week for those first 1 to 3 months. If money had nothing to do with it, if paying for treatments had nothing to do with it, if you were my brother or sister, I would say give it at least 6 months of being consistent and committed and knowing what you want. And there's so much more in the therapy that I would do, but just telling people, just knowing what you want and staying committed to it and following through with whatever protocol your acupuncturist would recommend, or therapist, or whatever, or whoever you see. But I can guarantee you from my own experience, it worked for me, and I kept that weight off until I gave birth to my first child, and I had gained 60 pounds with her, and I lost it. And then with my second child, I had gained about 45, 50 pounds with her, and I lost it. And then I have a newborn, and he'll be 11 weeks. And, I don't feel like I'm not going to lose it. I feel like I'm going to lose that weight, the baby weight. And I look at food like it's something that I need to eat and not something that I'm addicted to, something that this is essential to my life because I'm nursing him and I have to live and I have to have the energy, but not how many calories am I eating, not feeling badly for what I'm eating, and having a good relationship with food. So I hope this has been very helpful, and I wish you tremendous success this coming year, and I hope that you really see that version of your better self, of whatever that better self is. There's always room for improvement. You may have the perfect body, but there may be something that you might want to do better, like maybe be more kind to people, or you might want to make sure that your immune system's stronger than it has been, or you might want to be more patient instead of feeling overwhelmed and stressed out. There's always room for improvement. So today we talked about eating disorders. I hope that you have a great relationship with food, and if you don't, call me or contact your local acupuncturist, and I hope you have a great day. My 2 websites are committedtoabetterme.com and moveyourchi.com. Take care.